Why is there so much controversy among medical professionals about whether or not cartilage can heal itself? That is the question that we are going to answer today. Recently on my YouTube channel, I got this question asked of me after a video I had posted. I'll link that video here. But it was really important because it reminded me there is a very clear reason why medical professionals do not agree on if articular cartilage can heal. So we're going to discuss 1, what is cartilage? 2, what's all the controversy about? And 3, what do I do about that? What's my take-home message? Let me start by explaining that every tissue in your body, including articular cartilage, is designed to heal itself as long as it's moving correctly. Now, that is a true statement. However, it's the last part that can get pretty tricky, especially when it comes to articular cartilage. Articular cartilage is like the shock absorber that helps to line joints so that they can glide across each other and not bump into each other and cause trauma or damage or bad things to happen as your skeleton like bangs into each other. So it's basically kind of like the shock absorbers of the system, if you will. And it is found in every single joint we have. So in your spine, in your hips, in your knees, all your feet, it is everywhere throughout your body. Most commonly, the question of can articular cartilage heal comes up in regards to knees. And the reason why is because people will hear that their cartilage is degenerated. They'll hear that they're bone on bone in their knee, which means I have pain and there's nothing I can do because the cartilage is gone. It's like it just disappears. And so it's bone on bone, which then they are told leads to pain. So first thing, I'm going to go down a bit of a trail here. I have treated patients who have been diagnosed with by x-ray with bone on bone knee pain that I have been able to help relieve without needing surgery, even without needing injections or pain medication. So if you are interested in learning more about what you can do to help heal your knee pain, then I definitely recommend checking out our channel. We have a bunch of knee pain videos. I'd also recommend getting a copy of my new book, Movement is Life, because that will give you some really great ideas on what you can do to help your knee pain and also just help you live a more pain-free life. I'll drop a link for that below. But let's get back to articular cartilage. Does it actually heal? Why does everybody disagree? The reason why everybody disagrees is because articular cartilage is one of the few tissues in our body that does not have a direct blood supply. So what this means is when there's damage, the blood vessels cannot bring in the nutrients that are required to heal. So people say, many people say, articular cartilage cannot heal itself because it does not have direct blood supply. Now, that is true. Articular cartilage, in most cases, does not have direct blood supply. However, that's not how articular cartilage gets its nutrients. Articular cartilage is more kind of like a sponge. And what it needs for its nutrition is compression, decompression, and gliding. So if you think about that with your knee, compression, so we're going to pretend like this is the femur. We're going to pretend like this is the tibia, so your foot would be down there at that end, okay? Femur, compression, decompression, okay? Again, gliding is going to be this motion here. And I know your femur doesn't move that much, but it helps you to be able to see it, right? So compression, decompression, here's the gliding. All right, how does our body do that? Very naturally, all the time. When you are walking, as long as you are walking correctly, the joints are moving correctly, the muscles are moving correctly, the ligaments are moving correctly, everything is moving correctly, you are actually providing nutrition to the articular cartilage. And you see, friends, this is why it gets so tricky, because people who have articular cartilage issues don't have normal joint biomechanics. They don't have their muscles moving correctly. They may have some ligament issues as well. Maybe they've got some stuff going on at the foot. Maybe they've got some stuff going on at the hip that has all led to this articular cartilage problem. And that's why the doctors say it can't heal, because it doesn't have a direct blood supply, but you also don't have compression, decompression with gliding. Something in the system has gone wrong. So what can you do about it? Well, you need to find a really good manual physical therapist who is going to be able to understand A, what's going on with your articular cartilage right now and what's causing the pain or dysfunction, but B, what is the root of it? Is your foot not interacting with the ground correctly? Is your hip weak? Do you have an SI joint that's rotated? There's a lot of things that can be putting increased stress through that articular cartilage. And again, here we're talking about mainly the knee, for example, but if this can be true of any area, it would just be different joints and muscles that are affected, okay? So hang with me here. What is causing that articular cartilage to degenerate and then also keeping it degenerative? So many doctors will say that you have to have surgery because there's no way that this is going to heal on its own. And I will agree, if you continue doing the same thing and expecting a different result, it's not going to heal on its own, right? That's the definition of insanity. You have got to change what caused that articular cartilage to damage in the first place, which means you need the help of a really good manual physical therapist to look at what is going on in your particular instance to help unload that knee and provide the right stimulus for repair so that that articular cartilage can heal. I really hope this was helpful, and I really hope it was clear. If you have any more questions about that, please drop them below. I would love to make another video. This is a passion project of mine, is really helping people to understand their bodies so that they know how to interpret what's being said in the medical field. Too many times right now, I'm seeing doctors whisk patients off to the side, not listen to their concerns, tell them this is what you have to do. There are no other options. And in some cases, there are some other options. What you need is someone who will listen to you completely and help explain those options to you so you know what the best option is for yourself.